we are going to discuss regarding a very important topic, why like pediatric trauma and how it is different from adult. So pediatric bone is dynamic, which is completely different from adult, which is static. Why it is dynamic? Because in pediatric age group, the bone constantly elongates as well as thickens. So this unique feature of pediatric bone makes it immensely different from adult. So how a trauma is different in pediatric age group than in adult? The most common injury in a pediatric age group is in the upper limb or around the elbow. The most common trauma, one of the example is what we called as a pulled elbow. Many a time patient come to us with a complaint of elbow pain and the child refuses to move the arm. So many of times it happens as while we are holding a child, then the joint, the elbow joint, the superior elbow joint, the superior, to be specific, it is the superior radiocapitular joint, that is the joint between the radius and the ulna, it subluxates. So while it subluxates, while it comes out of its position, it causes immense pain and the child refuses to move his hand. So a very simple maneuver will just put that displaced fragment into its place and child will again become normal. So this is what we say is a most common injury or a pulled elbow. In fracture also, the most common fracture in children is around the elbow, which we say is a distal humerus or a supracondylar fracture of the humerus. Mostly it will require a cast treatment, but yes, there are severe varieties of it which requires surgical treatment as well. Coming to legs, you can see a very common injury is around the ankle, where suddenly while walking or while running, your child twists the ankle and there is a pain and swelling in the ankle. So this is there is a very important ligament in our ankle which is known as anterior talofibular ligament, which is generally sprained or torn in case of this kind of twisting injuries. So a very simple treatment for this is rest, and we can put some immobilization in the form of plasters. Apart from this, there are grievous injuries like the femur fracture. Femur is the thigh bone, which we see is the most common lower limb fracture for a child is a femur fracture, where it breaks the femur. And unlike adults, I'll repeat, unlike adults, a femur fracture in adult will definitely require surgery, but in child it can be managed very easily in a plaster. So we can see that there are a lot of difference in management, in diagnosis, in adult as well as children. Apart from this, we see generally the occult fractures. Occult fracture is something which is hidden off, which we cannot see in x-rays. So very commonly we find injuries where x-ray looks normal, but the child refuses to move the leg or refuses to move the limb. These are known as occult fracture, which are very common in child. So to diagnose this occult fracture, we need to have a very high grade of suspicion and we might require advanced imaging in the form of MRI. The third problem which we have while treating a child with trauma is the localization of exact place where the trauma has taken place. For example, a child might have a trauma in the elbow, but while examining, his whole hand will be in pain. Wherever we will touch the child will cry. So it is very difficult to localize the exact place where the trauma has taken place. If we cannot localize the exact place, we might end up taking wrong x-rays and giving you wrong diagnosis. And again, so that's why we need to have a very high suspicion of all the exact anatomy and where we should concentrate our clinical examination. Many of time it happens that we need to take the x-ray of the opposite limb, the normal limb, just to compare with both. The treatment part is very simple. Generally in pediatric child, what we do is the acronym name RICE, RICE, where a rest, immobilization, compression and elongation would suffice the problem. So the minor injuries like elbow sprain or ligament sprain or ankle sprain will subside with this kind of treatment, which is acronym as RICE. The difficult situations like complicated fractures will require mostly a cast treatment, that is a POP plaster treatment, and 90% of the cases it heals in plaster. But sometime in those 10% of cases we need to have surgical intervention. So this is a very important point which we should keep in mind, that maximum amount of pediatric trauma can be managed in simple plaster and unnecessary surgeries needs to be avoided. So my advice will be, always overdiagnose an injury in a child and please consult a proper pediatric orthopedic surgeon nearby to get appropriate and accurate and appropriate management.